This video is about religious experiences and bipolar disorder. It shows the results of a research project at the University of Groningen in the Netherlands. People with bipolar disorder can have experiences they view as religious or spiritual. Such experiences can make a big impression upon them. These usually occur during mania. During mania, people might experience the presence of God or the presence of a divine reality. Sometimes they feel strongly connected or even at one with nature, with humanity as a whole, with the universe, or with the divine. Others might feel they have an important mission in the world, or think they are an influential religious person. Another experience reported is the feeling of synchronicity. Everything seems connected and nothing is perceived as coincidental anymore. Such experiences often go hand in hand with symptoms of mania. The manic drive sometimes causes people to endlessly immerse themselves in such spiritual experiences, desiring to capture their meaning or to change the whole world. During mania, people can be very sensitive to other worlds. This can be experienced so strongly that they lose their grip on reality. Positive experiences can become frightening. This can even manifest itself as a perceived dissolution of ego. During depression, the absence of faith or spirituality is a recurring condition. The beautiful spiritual experiences that were enjoyed during mania have now completely disappeared. People feel completely empty inside. Trust and hope are absent. Often spirituality no longer plays a part, and some people feel abandoned by God. When people need hospital treatment or medication, this can make them feel cut off from their religious experiences. This can also happen when somebody gets depressed after a manic episode. For many, a quest begins. Are my experiences genuinely spiritual, or are they primarily a consequence of the disorder? It's often not easy to find an answer to that question. And it's not possible to talk to everyone about the subject. People sometimes feel reluctant to talk about religious experiences with their therapist because the experiences might be seen as pathological. And when you're looking for an answer on the internet, many different and often contradictory explanations can be found. In the research we have done, people have had different reactions to their religious experiences. These reactions can be categorized into three groups of people. Some people want to distance themselves as much as possible from these experiences. They view them as unrealistic and related to the illness. It's also possible that someone's partner or family want to prevent the diagnosed patient from getting too involved in spirituality or faith. This can be a reason for keeping a distance from such experiences or even abandoning faith or spirituality altogether. Another group of people view their experiences as a spiritual crisis. They feel their experiences are an attempt at the soul to cope with trauma or unresolved issues from the past. Therefore, this group thinks it's important to unravel the meaning of their experiences, as they feel these experiences are a chance for spiritual growth. The largest group in the study consists of people who regard their experiences as both authentically spiritual and related to the disorder. They feel their experiences are paths to a higher dimension, but the disease hijacks and distorts them. For other people, these are very valuable experiences, but when they have recovered from a manic episode, these experiences are difficult to integrate into daily life. Our research has shown communication about religious experiences is important, particularly talking about its meaning with unprejudiced listeners. Contact with peers who recognize your story because they have experienced similar things can be beneficial as well. Many people report that finding a balance in their involvement in spirituality is crucial. Faith and spirituality can have an important role in their life, however, it is essential they remain grounded. Some people with a long history of bipolar disorder report that their involvement in religious experiences in the initial phase of the disease was excessive. Through trial and error, they learned to see their experiences in perspective. To many people, they remain important experiences that reveal something about the nature of reality and our eventual destiny.